Hello, my name is Madhu and I am a pharmacy intern. I wanted to discuss today the use of apixaban for the management of atrial fibrillation in patients on hemodialysis. In this case, we want to consider whether apixaban would be more appropriate than warfarin for a 62-year-old female who is 68 inches tall, weighs 98 kilograms, has a serum creatinine of 9.2, CHA2DS2-VASc score of 6, and is on hemodialysis 3 times per week. For this case, I wanted to consider patient-specific factors such as her CHA2DS2-VASc score of 6, her calculated creatinine clearance of 7.8 milliliters per minute that was found using her adjusted body weight, BMI of 32.8, and current literature on the use of apixaban in patients on hemodialysis. So apixaban is approved for the use in patients with end-stage renal disease, and an open-label single-dose study conducted in 2015 compared the use of apixaban 5 milligrams daily in patients with normal renal function to those with end-stage renal disease maintained on chronic hemodialysis. The results ultimately suggested no impact of end-stage renal disease on apixaban absorption or other pathways of clearance, and suggest that apixaban can be used in patients with end-stage renal disease without a need for dose modification. However, it is important to note that this study did only include 16 participants. Another single-centered retrospective analysis conducted in 2017 compared safety outcomes of apixaban and warfarin in patients with end-stage renal disease. 160 patients were included in this study, and the results showed no observed differences in bleeding rates in patients receiving apixaban compared to those receiving warfarin. The baseline characteristics of the patients on apixaban in that study were somewhat similar to those of this patient. The CHA2DS2-VASc score ranged from 1 to 6, body weight ranged from 59 to 97 kilograms, and the age ranged from 60 to 81 years old. However, it is important to note that the mean serum creatinine was 5.6 and was only as high as 7.5, but this patient does have a much higher serum creatinine level of 9.2. A retrospective multi-center study that included 707 patients was conducted in 2020, very recently, and compared apixaban and warfarin in hemodialysis patients as well. They found that hemorrhagic risk was lower with apixaban than with warfarin, and that it at least did not increase thrombotic events. This study also had patients with similar baseline characteristics to this 62-year-old female. The body weight ranged up to 100 kilograms, and the mean age was 68.8 with a standard deviation of 16. So all these studies suggest that apixaban could be just as effective as warfarin at preventing thrombotic events in this patient with atrial fibrillation and on hemodialysis, and could also be safer than warfarin in terms of bleeding risk. If it were to be started, apixaban 5 milligrams BID should be used. Per Lexicomp, the dose-adjusted 2.5 milligrams BID is only needed in patients on hemodialysis if either their body weight is less than 60 kilograms or age is above 80 years old, neither of which is true in this patient. Additionally, one of the studies showed that apixaban 5 milligrams BID resulted in less thrombotic events and fewer major bleeding events compared to warfarin, while the reduced dose of apixaban 2.5 milligrams BID did not reduce the amount of thrombotic events that occurred compared to warfarin, and only reduced the amount of major bleeding events. So although most studies have shown that apixaban can be used with caution in patients on hemodialysis, it is important to note that there is a lack of randomized controlled trials in this area, and some of the patient's factors, such as her obesity, have not been considered in the studies that have been done. Therefore, larger prospective studies need to be conducted to have a more definitive answer on whether it is appropriate in this patient. In the meantime, if apixaban 5 milligrams BID is started, the patient should be monitored very closely for thrombotic events, bleeding, and worsening kidney function. Please let me know if you do have any other questions or would like to discuss the studies or dosing further, and I'd be happy to help. I have also included the references for the studies I discussed for your convenience below. Thank you.